Welcome to the deep dive. Today, we're diving into something pretty incredible. We're going to explore how artificial intelligence is changing the world of healthcare management.
Yeah, it's a really hot topic.
It is. And we've got a ton of interesting stuff to unpack, research papers, articles, and even some notes from recent conference all about AI in healthcare.
It really shows you how much this field is exploding right now.
It's amazing to see how fast things are moving. Now, I know when some people hear AI, they might think of robots performing surgery, like something out of a sci-fi movie.
Right?
But it's so much more than that, isn't it?
Absolutely. It's about using AI to streamline everything, to make healthcare run smoother, more efficiently, from how hospitals use their resources to how patients get that personalized care.
Right. And it's not some futuristic fantasy anymore. It's happening right now. Like, we're going to cover things like how AI is helping hospitals manage their resources better, predict what kind of care patients might need down the line, and even tackle all those administrative tasks that can bog things down.
Yeah, it's pretty mind-blowing.
It is. But before we get too far ahead of ourselves, I think it's helpful to take a step back, to get a little historical perspective.
Oh, for sure. Context is key, right?
Totally. So if we rewind the clock, let's say to the early 20th century,
Okay, way back.
the healthcare system looked completely different back then.
It was a different world. Everything was much more decentralized, resources were incredibly limited, and technology, as we know it, barely played a role.
Right. Like, can you imagine trying to run a hospital today without computers, electronic health records, all of that?
It's mind-boggling, really.
It's like trying to imagine life without the internet.
It's crazy. So when computers came along, and then later electronic health records, those were absolute game changers.
Huge.
They paved the way for this whole data-driven approach that we're seeing today. Really set the stage.
And that's where AI comes in.
Exactly.
It's not just some random tech intrusion. It's the natural next step in this evolution towards a more efficient, effective way of managing healthcare.
It's taking all this data that we've been collecting and using it to solve some of healthcare's biggest problems.
The problems that have been around forever.
Exactly.
So let's get into it. Where are we actually seeing AI make a difference in healthcare management today? What's out there right now?
Well, one of the biggest areas is resource allocation. I mean, think about it. Hospitals have to manage staff, equipment, bed availability. It's a constant juggling act.
It's a lot.
It is. But AI can analyze all the data from the past, and it can actually help hospitals use those resources better.
Yeah.
And we're talking about shorter wait times, a better flow of patients, smoother operations overall.
Right. And it makes such a difference. I was reading about the Cleveland Clinic. They implemented an AI system for exactly that, resource allocation, and they saw a 20% increase in how many patients they could admit.
Wow.
And get this, a 60% decrease in emergency room wait time.
That's incredible.
That's going to be a huge relief for everyone involved, patients and staff.
Absolutely. It's a perfect example of AI having a real impact.
Yeah. And it's not just efficiency either, right? AI can also be used to predict what kind of care patients might need in the future. It's like having a crystal ball.
It is kind of like that. It's called predictive analytics, and it's really powerful.
So wait, are you telling me AI can, predict health issues before someone even knows they might have them?
In a way, yeah. AI can go through mountains of data, a patient's medical history, lifestyle, even genetic information, and look for those hidden patterns that might point to future risks.
That's wild. Do you have a real-world example?
Absolutely. So Google's DeepMind Health, they teamed up with the Royal Free Hospital in London, and they were able to spot patients at risk for acute kidney injury a full 12 hours earlier than traditional methods.
Wow.
I mean, that early detection can be life-saving.
That's amazing. It's like having a personalized early warning system for your health.
It really is.
And speaking of personalized, I know AI is playing a big role in this move toward precision medicine.
Huge role. It's all about tailoring those treatments to each individual patient's needs.
Yeah.
AI can analyze all that genetic and clinical data and help doctors come up with the best treatment plans for you, for your specific situation.
It's like having a custom-made suit, but for your healthcare.
Exactly.
But let's not forget about the more administrative side of things. I can only imagine how much paperwork and data entry happens in a hospital. Is AI helping with that too?
Oh, absolutely. It's a game changer there. AI systems can automate all sorts of tasks, scheduling appointments, entering data, even handling billing, things that take up a lot of time for healthcare professionals. It's like having a super efficient digital assistant that never needs a break.
Right. But it's not all about robots and algorithms, is it? There's got to be a human element to all of this.
For sure. And one of the biggest benefits of automating these tasks is that it frees up healthcare workers so they can focus on what they do best, caring for patients.
Right.
It's a huge win,
Yeah.
especially for nurses who often get overloaded with all those administrative duties.
It's true. So AI can actually help improve the patient experience by giving healthcare providers more time and energy to connect with their patients.
Exactly. And that personal touch is something that AI can never replace.
No, never. So I've talked about how AI can improve things in theory. I'm curious to see how it's actually playing out in the real world.
Me too.
Are there any specific examples of hospitals or healthcare systems that are using AI in really cool ways?
Oh, tons of examples.
Mm.
One of the most well-known is IBM's Watson for oncology. It's also called WFO.
Okay.
It's a system that helps oncologists, those are the doctors specializing in cancer treatment. It helps them recommend the best treatment options for their patients.
Wow. That sounds super high tech. Is it actually accurate, though?
The results have been really promising. Studies have shown that WFO's recommendations often line up with what expert oncologists would recommend. So it's pretty reassuring for everyone involved.
Yeah, especially when you're dealing with something as serious as cancer. You want to know you're getting the best advice.
Right.
Are there any other cool examples?
Another company doing some really interesting work is PathAI. They've created AI-powered pathology assistants. Pathologists are the doctors who analyze those tissue samples to diagnose diseases. And these AI assistants are helping them be even more accurate.
So AI is actually helping diagnose diseases better. That's pretty amazing.
It is.
But I know that whenever we talk about technology, especially in healthcare, something so important, we have to talk about the ethical considerations.
You're absolutely right. There are a lot of things to consider, and it's something we need to explore further.
Definitely. But first, I think it's important to understand how different groups, all the stakeholders in healthcare, are reacting to all of this.
Yeah. It's important to see all the different perspectives.
Absolutely. So let's dive into what doctors, patients, and even regulators think about this whole AI revolution in healthcare.
It's so interesting to see how everyone's reacting to AI in healthcare. It's like we're all, trying to figure out where we fit in with this new technology.
Yeah, it's a lot to process, for sure. So let's start with the people who are like on the front lines, the healthcare professionals. What are they saying about AI becoming such a big part of their work?
Well, it's a mixed bag. Some healthcare professionals, especially those who have been in the field for a while, they might be a bit hesitant about, relying too much on technology.
Yeah, I get that. Change can be hard, especially when you're dealing with something as important as people's health. You don't want to mess around with that.
Absolutely.
Yeah.
But there are a lot of healthcare professionals who are really excited about AI. They see it as a powerful tool, something that can help them do their jobs even better. Like, for example, some radiologists are using AI to help them analyze medical images, like X-rays and CT scans.
Oh, wow. So it's like having a second set of eyes, making sure they don't miss anything.
Exactly. It's like having a superpowered assistant who can spot those tiny details that could make a huge difference in a patient's diagnosis and treatment.
I bet that's super helpful. What about nurses? How is AI changing their day-to-day work?
Well, like we talked about before, AI can take care of a lot of those administrative tasks,
Yeah.
the paperwork and data entry that nurses often get stuck with.
Mm.
And that frees them up to spend more time with their patients, giving that one-on-one care that's so important.
That makes a lot of sense. I was reading a paper about how AI is being used to, help nurses make better decisions about patient care, too. It can analyze tons of data about a patient's condition and suggest the best course of action.
It's really cool. It's like AI is supporting them and empowering them to make the best decisions for their patients.
That's great. And it's not just radiologists and nurses. I mean, we're seeing this trend in other areas of healthcare, too, right? Like pharmacies, operating rooms, pretty much everywhere.
Oh, yeah, it's popping up everywhere. And it's not about replacing healthcare jobs. It's about making those jobs better, more efficient, and letting healthcare professionals focus on the human side of things.
Right, the parts that really require that human touch. So it sounds like AI is changing the nature of work in healthcare, but not necessarily getting rid of jobs.
Exactly. It's about using technology to handle the stuff that can be automated, the repetitive tasks, and freeing up human expertise for the things that need empathy, critical thinking, and a personal touch.
Makes sense. But this shift is going to require healthcare professionals to adapt, right? Like, how are they going to learn all this new technology? How do you even begin to train for that?
That's a really good point. Medical schools, nursing programs, they're going to have to start incorporating AI into their curricula, make sure future healthcare workers are ready to use these tools.
It's like learning a whole new language almost. You have to know how to talk to these AI systems and understand the information they're giving you.
It is.
Yeah.
And it's not just about initial training either. Healthcare professionals are going to need to stay up to date, keep learning about new AI advancements throughout their careers. I mean, this field is changing so fast. Continuous learning is going to be key.
It really feels like we're on the brink of a whole new era in healthcare.
It does.
One where technology and human care are working together, in this really integrated way.
It's exciting. It really is an exciting time to be a part of this transformation. But like with any big change, there are always going to be challenges, right?
Right, yeah. So let's talk about some of those challenges. What are the hurdles we need to overcome to make sure AI is used safely and effectively in healthcare? I mean, we want to do this right.
Absolutely. One of the biggest challenges is making sure that these AI systems are actually accurate and reliable. We're talking about people's lives here, so there's no room for AI making mistakes.
What the stakes are really high. So I imagine a ton of testing and validation goes into these systems before they're even used.
Oh, tons. It's a super rigorous process.
Mhm.
And it doesn't stop there. You have to constantly monitor these systems, make sure they're updated. As new data comes in, you have to stay on top of it.
Right, because AI is only as good as the data it learns from, right?
Exactly. And,
Yeah.
in healthcare, that data can be messy and complicated.
I bet. So how do you even begin to work with that?
It's a challenge. And another big one is making sure that these systems can integrate into how healthcare already works. I mean, hospitals and clinics, they have their own ways of doing things. And throwing in new technology can really disrupt that.
Yeah, it's like trying to fit a square peg into a round hole sometimes, right? Just doesn't quite work.
That's a great analogy. It's not just about the technology itself. It's about how you implement it. You have to make sure it fits in with how healthcare is already delivered.
It's about making it work for everyone. So we've talked about the healthcare professionals, their perspective on AI, but what about the patients? What are they thinking about all this? I mean, it's ultimately their health that's being impacted.
Right. It's their data, their
Yeah.
lives. Well, just like with healthcare professionals, there are a lot of different opinions. Some patients might be a little uneasy about sharing their personal health information with an AI.
Yeah, that makes sense. I mean, data privacy is a big deal these days. We hear about it all the time.
It's a huge concern, and it's something that has to be handled really carefully. But a lot of patients are actually really excited about what AI can do for them.
Yeah. Like what kinds of things?
Well, things like getting treatment plans that are specifically designed for them, quicker diagnoses, and even catching potential health problems early on.
It's about being proactive.
Exactly. Those are all things that patients are definitely interested in.
Makes sense. I mean, who wouldn't want their healthcare to be more personalized and efficient? I know I would.
Right. And there's this whole potential for AI to help patients understand their own health better, too.
Oh, interesting. How so?
Like imagine having an app on your phone that's powered by AI. It analyzes your symptoms,
Yeah.
gives you information about your condition, even answers your questions. It's like having a 247 healthcare advisor right there in your pocket.
That would be pretty amazing. So it's like empowering patients to be more proactive and informed about their health.
Exactly. And it could help take some of the pressure off healthcare providers, too.
Yeah.
Patients could get answers to their basic questions without having to schedule an appointment every time.
Right. It could really streamline things. Okay, so we've talked about the healthcare professionals, the patients, but what about the people who make the rules, the regulators? How are they dealing with all of this? What's their role?
They're super important. It's their job to make sure these AI systems are safe and effective before they're used on patients.
So they're like the gatekeepers, making sure everything meets the standards.
Exactly. They're working hard to develop those guidelines, the regulations for AI in healthcare, to make sure it's done responsibly.
Right, because it's a balance, isn't it? You want to encourage innovation, but you also have to protect patients.
Absolutely.
Yeah.
It's a complicated situation, and they have to think through all the angles.
This has been such a fascinating conversation. It really feels like we've just scratched the surface of what AI can do in healthcare.
I know. There's so much more to talk about.
But for now, why don't we shift gears a bit and talk about how AI is impacting patient safety?
Okay, yeah, let's get into that. It's a really interesting area with a lot of potential.
I'm ready. Let's dive in and see how AI is making healthcare safer for everyone. Okay, so we've covered a lot of ground here. We talked about how AI is changing the roles of healthcare professionals, how patients are feeling about this new technology, and all those challenges of making AI work within our healthcare systems. But now let's zoom in on one really crucial aspect: patient safety. I'm really interested to hear how AI is making healthcare safer.
Yeah, me too. It's a really exciting area. One of the most promising ways we're using AI to improve patient safety is by developing early warning systems.
Early warning systems. Okay, what are those?
So these systems can look at a patient's data, like in real time. They're constantly analyzing it, looking for any tiny changes that might signal that something's wrong.
So it's like having an AI guardian angel watching over patients, alerting doctors and nurses if anything seems off.
That's a great way to put it. And these early warning systems, they can be used everywhere. Like you see them in hospital ICUs, nursing homes, even for patients being monitored at home.
I was reading about a study and it was talking about how AI can actually help reduce the risk of patients falling in hospitals.
Yeah, that's a big one.
I know, it sounds kind of surprising, but apparently it's a pretty common problem.
It is, and those falls can cause serious injuries, especially for older patients. So what AI can do is it can analyze data from sensors, cameras, things like that, and pick up on those subtle clues that a patient might be at risk of falling.
Oh, wow.
And then the healthcare team can step in and, prevent an accident before it happens.
That's amazing. So AI isn't just helping us diagnose and treat diseases, it's also helping to prevent things from going wrong in the first place.
It's all about being proactive.
I love that. But, whenever we talk about all this potential for good, I always wonder if there are any downsides. Are there any risks to using AI in healthcare that we need to be thinking about?
Of course. I mean, any new technology comes with potential risks. You have to be aware of those. And one of the big concerns with AI is, well, cybersecurity. Could these systems be hacked?
Oh, right. Yeah, that's a scary thought. I mean, patient health data is so sensitive.
It is, and that's why cybersecurity is a top priority for anyone developing these systems. They're constantly working to make them secure, to build in those safeguards, to prevent anyone from accessing that data.
That makes me feel a little better, knowing that people are taking it seriously. Are there any other concerns we should be thinking about?
Another really important one is fairness. We need to be absolutely sure that AI systems are designed and used in a way that's fair and equitable for everyone. All patients deserve that.
That makes sense. But what does that look like in practice? How do you make sure AI is fair?
Well, we have to make sure that these AI systems aren't just repeating, perpetuating those biases that already exist in healthcare. Let me give you an example. If an AI system is trained on data that mostly comes from one specific group of people, let's say, it might not be as accurate or effective for patients from other groups. Does that make sense?
It does. So you're saying it's super important to make sure that AI systems are trained on data that represents everyone, data from all different kinds of people.
You got it. That's one of the key ways to help reduce bias, to make sure that these advancements benefit everyone equally. No one should be left behind.
That's a really important point. As we wrap up this deep dive, I have to say I'm feeling a mix of emotions. I'm excited about all the ways AI can improve healthcare, but there's also a part of me that's a little bit apprehensive. It's all happening so fast, and it brings up some pretty big questions.
I agree. I think it's important to be both enthusiastic and cautious. We need to keep our eyes wide open, be aware of those potential risks, while also being open to all the amazing opportunities AI can bring to healthcare.
Absolutely. Well, this deep dive has definitely given me a lot to think about. We've covered so much, from how healthcare management has evolved over time to the ethical considerations of using AI in such a personal field.
It's a lot to take in.
It is. But one thing is clear. AI is here to stay. It's already reshaping healthcare as we know it, and it's only going to become more influential in the years to come. So to everyone listening, thank you for joining us on this deep dive. We've only just scratched the surface of this topic, but hopefully it's sparked your curiosity and giving you a better understanding of how AI is transforming the world of healthcare management. The future of healthcare is being written right now, and AI is playing a leading role. So stay informed, stay engaged, and let's see what amazing things we can achieve together.